going to get started. Welcome to those of you on webcast. Welcome, Sherry. And good morning on this early Monday morning. I just wanted to take a few minutes to introduce our speaker, but also just to say, so as per normal with our rounds, we have people in the room, we'll have people on webcast. So at the end for questions, Angela and I will be tag teaming up here to repeat the questions so people on webcast can hear them. We're also video recording today the speakers. We're testing out ways of being able to reproduce it for recording and sharing afterwards. So without further ado, I want to introduce Dr. Angela Wolff. She's a clinical assistant professor in the School of Nursing, and she's also the director of clinical education professional practice at Fraser Health Authority. And she's presenting research she's been involved with around barriers and facilitators of student practice education, which I know is a very relevant and timely and important question, especially right now. I know there's some struggles around that. So Angela has a bit of a struggle with her voice today, so she's going to do her best, and we'll
do my best to show my passion for the topic.
That's right. Welcome. Thank you, Angela.
Thank you. Thanks, everybody, for being here today. Here it's reading week, so it's a nice, quiet week. Really, this journey started in part of my role in professional practice is the student practice education as a part of my portfolio. So all the students that come through Fraser Health come through professional practice in terms of the infrastructure and the individuals that help to support students throughout Fraser Health. So that includes not only nursing, but all of the professions that come to Fraser Health. So in starting this role in 2008, actually we didn't have a centralized system for student practice. So each site would just field requests, and it was sort of a hodgepodge everywhere. And so at that time then, there became, through professional practice, we were able to put together some briefing notes for the executive and to really look at how we can have more centralized process within Fraser Health. And so HSPNet is one of the tools that we're currently used within nursing and provided a good start in terms of how placements were organized. But then moving it into a centralized system throughout Fraser Health as opposed to each site was a way to sort of just strengthen how we support students in Fraser Health. This particular study came about as part of that work, as well as the places study that I'm going to talk about. The two proposals sort of happen simultaneously, and as it goes with most funding, when you're submitting one proposal and waiting to hear back, we had another proposal happening at the same time. So this one was more specifically came out of some of the work that was being done in my presenting and being involved with the executive team. The VPs and the CEO were very interested in this topic and creating a learning culture within Fraser Health. And so Fraser Health has a number of different grants, and one of them is called the Strategic Imperative Grant, which we were able to get internal funding then to do this study. So myself, as well as Leanne Curry, who's in the back as well, was a part of the study, and Grace Mickelson, who's the corporate director for academic development at PHSA, as well as within Fraser Health and how students are organized. Carrie Edge was the clinical nurse educator at the time, so we have an educator. And some of you may know Nora and Forrest, who are two coordinators that centralize looking at student placements within our department. And then Andrea Burrows was a master's student at the time, and she was our research assistant on this project as well. And then the second project that was a part of this, I'm going to just talk about some of the context about how we know the volume and the utilization of student placement in Fraser Health came through the Places project, which looks at the placements for learning assessment, looking at the capacity and the effectiveness of clinical placements. And again, it's myself, Leanne, and Grace Mickelson that are the PIs for this grant, and it was funded by the Michael Smith Foundation for Health Research in collaboration and supported by members of the Lower Mainland Clinical Education, Nursing Clinical Education Steering Committee. I'm not going to go through all the people involved, but basically that involves the stakeholders within the Lower Mainland. So this smaller project was in the context of Fraser Health, but then this was also within the bigger picture of a Lower Mainland study that was being done and that we've just completed and finishing the report for. So this is it's one of the visuals that we have within professional practice around in collaboration and supported by members of the Lower Mainland Clinical Education, Nursing Clinical Education Steering Committee. I'm not going to go through all the people involved, but basically that involves the stakeholders within the Lower Mainland. So this smaller project was in the context of Fraser Health, but then this was also within the bigger picture of a Lower Mainland study that was being done and that we've just completed and finishing the report for. So this is it's one of the visuals that we have within professional practice around supporting students in Fraser Health and recognizing that it's very small print, but it goes through the number of different roles. So if this is something that you like, I can send you the actual version of it as a PDF. But just recognizing the partnership along the journey that we have with students, from the placing coordinators, the post-secondaries, our receiving coordinators, Nora and Forrest, and then also the role of the destination coordinator, which is the person at the actual placing agent, the actual practice setting that would look at the actual requests that come in. And then recognizing the role of students and faculty in the orientation that they require and the support throughout the placement. So there's a number of things that we've tried to highlight both with our academic partners as well as the processes that happen internally and trying to support the destination coordinators in their role. So this particular project, we wanted to look at some of the barriers of facilitators for collaborative learning environments in Fraser Health units and sites that then help to support learning experiences for undergraduate nursing students. So we were particularly interested in nursing, given it's the largest population of students that we have within Fraser Health. And then some of you also were involved in some of the preliminary validity testing that we were doing on the clinical learning environment assessment tool. I don't know if you remember, but I recognize a few of you in the room from being in that discussion, which were further developed and still a part of the PLACES study, and we're hopefully going to be having a publication out soon. So that might be another presentation that you're interested in as well. So these research questions were really trying to look at some of the factors that influence whether people accept or decline the requests that come in. And we wanted to represent the four main sectors of acute care, community, home health, residential, mental health, and substance use. So I'll talk a bit about the sample in a minute. And then we also just wanted to look at perhaps some of the characteristics of the units that had the high percentages and the lower percentages of accepting students. And this was sort of our cutoff that we used was 75%. We saw as high. Anything less than 55% of accepting we saw as low. And then we also wanted to take a look at more specifically some of the organizational environment and the cultures that might be impacting and supporting learning within Fraser Health. I'm just going to highlight, we had the PLACES study, had three main research questions, but the one that I'm going to bring in here at this point is just looking at some of the volume and the utilization patterns. Initially, we looked up to 2011, which is the data that I have, but at the end of, with the length of the time of the study, we actually included up to 2012. So these numbers are actually higher than what I'm presenting here today. This was an initial graph that we put together when I first started, just taking a look at the trends of nursing. And HSPNet started to be used around 2002, I want to say 2005. Oh, it was 2005. But it was fully 2005. So 2005, you can see kind of where we were to start and the number of requests. So here, it's 1,400 requests that would have been accepted in Fraser Health. And this was the number of declines, 472. Now, I'm not going to get into the nuances of HSPNet, but declines is a little bit of a difficult challenge to understand because often if it's declined, the request is resubmitted and then subsequently might be accepted. So although they're declined, it might reflect some of the background work that's going on, but it doesn't mean a student didn't get a placement. But that's sort of the best that we have. So in looking at the accepts, you can see, in thinking maybe about your program and how it grew over that time, as did many programs within the Lower Mainland, is looking at the numbers. And you can see that in 2009, we were actually peaking almost to 3,000 requests that had been accepted for nursing in Fraser Health. And we're saying requests, that doesn't reflect, the number of students would actually be higher because some of these requests are preceptor and some are group. So typically, I think it was around, I want to say about 8,500 students that would translate into, which is almost 1 million hours of clinical time a year that is being supported. And so at that point, you could see that we had a 79% acceptance rate. And so this is a snapshot at nursing. And then we further, over the years, have taken a look at this slide. You can see includes all of the requests. So as we've been centralizing student placement at Fraser Health, we've also been bringing the other disciplines on. So this reflects all of the disciplines that were using HSPNet at the time. And some of the increase in requests just naturally reflect the number of disciplines that we've been bringing on, which I think we have close to 42 now that are actually using HSPNet. So you can see, though, the benchmark in 2009 was about 61% of accepting. So for nursing, it was actually higher than what the overall average was in terms of students being accepted or confirmed for their placements. And at that time then, when we looked at just the nursing alone, we had an increase of 105%, an increase in the total number of accepts by 105%. So although people talk a lot about the challenge of getting placements, there's actually a huge volume of increase, that increased by over 100% in terms of the requests. Let's see. So the executive team was very supportive of aiming to support all student requests that came within Fraser Health. And one of our strategic imperatives that this fell under was creating a research and academic development to foster a culture of curiosity and to support new models of education, as well as creating great workplaces that help to retain employees. Yeah.
Sorry, I just had one quick question,
yeah.
And I know it won't be captured on the tape, but the data you were just showing there was quite a steep rise in the declines. Did that map onto the inclusion of other people other than nursing? I just was curious about that. I see your acceptances have gone up, the declines really sharply increased.
So the question was, looking at this slide, about the sharp increase in the number of declines. We do break the data down by profession, but I don't actually have it mapped out in terms of what that looks like and if it's primarily related. I'm just going to go back to nursing. So I don't actually know the answer to that right now, but that's something that we could certainly take a look at in terms of how that maps out with nursing being an increase in declines. I would say that it probably does. I don't have the overall one, but I would say that it probably does.
When we only have the nursing data, it looks like a very similar picture to this.
Yeah.
Okay. So without the other domains. But it's not just BSN, it's LPN, MSN.
For PM, all those categories as well. Let's see. Yes, so this actually represents about 148% increase in declines, not taking into consideration, though, the proportion of people that might be, like the increase in people using it as well, which is something that we ended up doing in the places study, is then creating a proportional, looking at the proportional increase, which this doesn't reflect.
Thanks. Thank you.
Good question, though. So the other thing that we did was created these little geographical maps for the different sectors, so it was easier for them to see what those decline and rates were, what they actually look like. So if you'll see here, I'll orientate you just to this a little bit. Our little legend is that anything that was green means that the acceptance or the confirm rate is over 75%. The ones that are in yellow is 55 to 75%, or 50% to less than 75%. So you'll see the yellow. And the ones that are in red are less than 50% confirming. And then the circles versus the square means the circle is a group. So we looked at both what the values were for the group as well as the preceptorship, and then NR means no requests. So to interpret this, it would be, if you look at Surrey Memorial Hospital, they were accepting 95% of their group requests. But when you look at their preceptorship, it was 76%. So we tried to break it out. We do have these slides both broken down by group and preceptor as well as by profession. So you can see all the number of different ways that you can slice the data to try to understand it. But this was really interesting because then it gave a quick visual as well of looking at, well, we seem to actually be quite good in accepting group requests, and sometimes it's a bit more challenging with the preceptor requests. And in showing these were heat maps that I put together for the executive as well, so they could see that snapshot. And then their questions were more about, well, why is this happening? Why? And why would it be that some sites are, you can see here, Delta was accepting 100% of their requests. And, why is it that Mission Hospital is only accepting 50% of their requests? Why don't we have consistency across the health authority and what's happening there? So this is an example then of health promotion and prevention. Again, and so we looked at all of these different visuals for all of the different places. And then we could also quickly see certain sites weren't getting requests, and would that be appropriate for them not to be getting group requests? But we also showed these to all the clinical programs, and being quite competitive then, they were very interested in, well, why is a health unit, in Mission, we're taking group students, and over in Delta, they're not even getting requests to do groups of students. So why is that? And how are we actually using the placements that we have? And so we could go to the clinical programs to start asking them, tell us what's happening in your clinical program and how can we support you better in supporting student placement, student practice. And what was really interesting, we did this with mental health and substance use. And what we recognized is half of their places weren't even on HSPNet. So we worked with them over a year time to just look at what are all your placements, fill out the capacity tool on HSPNet, look at what types of students were appropriate for those places, and then actually add it on HSPNet. I don't have that right now, but if you look at the before and after of the slides, you can see the map is sort of covered now because it actually has all of the placements. So this data, we can also slice it by, so when I look at Surrey or the health units, in particular the acute care, then I can slice it by every unit as well. So there's lots and lots of data on HSPNet that can be used by site and by clinical program.
I just had a quick clarification question, Angela, if I may, and it was linked to the Mission yellow and red.
Yeah.
Are placements linked to capacity? So Mission, for example, would have a different capacity to
not necessarily,
okay.
No. But that's what we do a deeper dive when we take a look at that.
Yeah.
In particular, like Surrey, when they were expanding the tower, then we closely worked with them to see what students they were currently taking and then what capacity they would have with the opening of the tower. And so we usually work with people that are doing builds, like Royal Columbian will be doing, to then re-look at what their placement capacity would look like. So we try to use whatever opportunities we can when there's growth or expansion in a program to then wiggle our way into the door and find out how we can capture those. We actually just recently did this with residential care as well because it was really hard to find residential care placements, and so Forrest did a lot of work in trying to recapture it under residential care because a lot of them were actually under acute care facilities because residential was, the units were linked with an acute care hospital, but it was really hard to find them. So some of it is logistics, and I'm not even getting to the barriers or facilitators and just talking about the give background, but just to move on, these were some of the earlier slices of the data that we had within the Places study, but this is just to recognize in 2010-11, there was 1.8 million hours of clinical time being supported in the BC Lower Mainland for just nursing alone. Those geographical maps I was showing were also just nursing. And you can see Fraser Health, it's 982,000. So we almost support 1 million hours of clinical time compared to Vancouver Coastal, which is 541,000. And then PHSA or PHC, which is only 20,000. So you can see, we're almost double of what Vancouver Coastal would be supporting within Fraser Health, with not much infrastructure and not much support being done to support those students. And so you can see why we started wondering what's happening with the actual destination coordinators, because they're the ones that are sort of holding this all together with possibly not much support at all. I'm going to skip over those just because I want to get to the actual study piece. And so we did a qualitative study that was exploratory and descriptive in nature and in focus groups. And as I said, we were quite purposeful in looking at the sites that had high and low acceptance, and also the different sectors were included. And so with that, then we sought out to seek a sample of people based on those in mind. And so the invites only went out to certain groups based on these different criteria to be involved in some focus groups. So we did thematic analysis, part of the how we looked at the data. And overall, in our focus groups, we had 31 nurses participate. And this is a breakdown of them, just highlighting that for the most part, they would have been CNEs, but we also had individuals that were in other roles that were involved with students as well. And then this is the breakdown. You can see 61% were from acute care, which would probably reflect the nature of what placements look like. And then the ages of individuals. So this was a lot of data, really rich data that we had. And in going through it and trying to make sense of it, which took a lot of time actually going over the data and the transcripts, binders of transcripts. And this was some of our initial ideas that we were thinking. What really came out around student placement was this whole broker role, and I'm going to talk about that a little bit more. And we were looking at some of the things, the learning environment, the supports for staff, and then we started looking at a number of influential factors. And smiling at our journey, it's all like a flashback coming back. Really fascinating. And so this was just the initial. And we really saw this broker role as being really, really pivotal, sort of a make or break it to the responses that people are getting at the destinations or at the practice setting. So this is a key individual in the practice area that is that go-between or the mediary to make decisions regarding the placements. And they're really that individual that has to navigate these complex systems of what's happening in the health authority and what some of the priorities are that might be coming at them from the placing agency. And so they have a key role in being liaising and really having to deal with the students and the logistical issues that might come up either before the placement's secured or during the placement as well. And they really take on their role quite seriously in terms of how they're advocating for the receiving agency. Sorry, I keep getting confused between my fingers here. And the broker then is the key individual that would make those decisions to provide those positive learning experiences for individuals. And so they really talked a lot about and really talked about a lot of the values that underpin the work that they do in terms of how they both respect and honor the needs of the staff as well as the students, and how to try to find that balance that they needed to achieve in order to support students, but also to support the new nurses that were there in practice. So when we started looking at the data, we started talking about this broker role, and there was a number of things that came out in terms of what they were doing, and they talked about these things about how they read their staff, and they have this role of protecting both the staff and the students, how they assess this fit within, what they get in HSPNet and what they have at the other end and what the school's needs might be, and really taking on that role and also communicating with the team. And the number of things that were coming at them that affect their role. The least to say that often these were people that were clinical nurse educators that went to take on the destination coordinator role and were often doing it at the side of their desk, as well as not necessarily getting much support to actually orientate them to the role, other than to say, oh, by the way, we also take students here, and there's this HSPNet thing that you need to figure out, was sort of what the initial process was. And so when we took a look at this broker role and kept reading through the transcripts and talking in some of the analysis meetings, we really started going back to this overall process. This is sort of the black and white process of how placements happen, and you're probably familiar with it, with the request coming in, and then it goes to the receiving coordinator, and then we check the affiliation agreement, and it's make sure it matches with the site, and it's released to the destination coordinator. But it was this purple box that came to be really important in Leanne's mind, because we later realized that although we were talking about barriers and facilitators, we really were starting to unpack what this purple box was all about. And we started sort of naming it Unpacking the Purple Box, because that's what people were actually talking about in doing that. They were going through their decision-making process of what happens when, even though we see it as it's just a decline or accept, there's this world of things happening in unpacking this decision-making process before they actually get to declining and requesting. Because often we just heard, people might be pushing the button, but they were telling us a lot about the thinking that goes on behind that process. And so we started rereading through the transcripts and really trying to look at, what was it that people were telling us, and not just simplifying it in terms of barriers and facilitators, but then actually trying to understand the process that people go through in dealing with the requests and managing the requests. And so it became quite complex, because we started looking at different decision-making processes, and we had a few up here because I recognize I'm going to blow up a few of these, but do we have any more? There's a few more behind you, Leanne. I'm not going to, because I only have about 6 minutes left, I'm not going to talk about the whole process, but just give you an overview and share a few highlights about what really stood out in people's minds, because it became quite fascinating as they unpacked this whole process of what was going on for them. And the decision-making processes really look at, how many hours of someone doing this does it actually take to become more proficient, to become an expert? Because it was clear in our focus groups, you could get a sense of those that are quite novice in doing this role, and those that were quite experienced and quite savvy in making these decisions. And so for me, in the health authority, to me it was really important, because it helped to think about how can we further support and orientate destination coordinators to their role by understanding the process that they go through, and for them to be a bit more enlightened about this whole purple box that they're faced with this request, and how do they decide to accept and decline a placement. So over the main piece is that there's this observing piece, a piece called orientate, to bring people to decide and then actually act on what that looks like. So this piece gives you a breakdown of that whole observation piece. What are the observations that I'm going to call them destination coordinator, or the broker, makes in actually, before they actually make a decision? What are all the things that provide the context for with which they're going to make a decision. And certainly, one of the things that they talked a lot about was the unfolding circumstances of the practice area. And this is really a huge piece because it speaks a lot to the physical and the structural capacity to actually take students. It really looks at what are the characteristics of the receiving agency, what is the actual physical layout, what are the number of FTEs and individuals on the unit, and then the number and types of disciplines that might be coming there, and how many students can be supported at one time. And this piece became really important to us, the infrastructure piece, because it helped us realize that we need to look at how we're using the capacity tool that's on HSPNet, because often people weren't putting some of this information in there, so there was a mismatch, and that made it even harder to process the requests. And so we've been quite diligent in trying to work with the broker, the destination coordinator, that's the receiving coordinators, in being realistic about what this is about and what are the type of students that you can take. But on the flip side, that's created challenges because some of the placing coordinators used to cut and paste their requests, and now their requests didn't necessarily match what they needed last year, or we changed the placement capacity from last year and it didn't fit anymore. And so I think just recognizing how are we actually using the tools in HSPNet to try to get the right match. Then they talked a lot about the different supports that happen, not only for staff working with students, but also the supports that come from the schools of nursing, and what do those supports look like in order to be able to then help support the unit in working with students. And then where there's this outside information that was quite fascinating, that they talked a lot about, sometimes the information that was known about the placing agency, and there was a big chunk of information that they talked a lot about the instructor's knowledge, attitudes, and behaviors. And so really recognizing that the clinical teachers are truly ambassadors for the school. And I would say people were quite brutal in making decisions and in the experiences that they had, and in them not being a very positive experience one time. It really closed the door for future opportunity. And some of the things that we saw were not necessarily the feedback loop that the destination coordinator, the broker, did take it one step further to provide feedback to the placing agency. Or we don't necessarily know if the placing agency asked for feedback, but there's definitely a breakdown that if it was bad experience and the destination hadn't necessarily talked to anybody about it within professional practice, that was some of the outside information, or maybe some of the stereotypes that occurred, because again, there might have been conversation amongst the destination coordinators, and that might sway some of people's decision in their decision-making loop. So any information and knowledge that the placing agencies can provide on HSPNet, and again, one of the things that we're really looking at, there are options of being able to attach course outlines and the outcomes and those different things that really help the destination person or the broker know more about what that agency is actually looking for, that can support some of the decision making that they're doing. Then the second piece was really about this orientate, which is really the piece that is all part of how they might respond to an actual request. And the broker looks at the current state of evidence that we talked about, the objective information that they have, and then they move to this sort of orientate step before they make a decision. And really there were 5 key areas, and it looks really messy because it is really, really messy in that piece. And still taking a lot of work to sort of unpack what does that look like, because they are all very interrelated in that messy piece of trying to figure out how to respond to a request and make a decision. So sometimes there was this new information that they might get. Here's, again, where they talked about previous experience. So we really were trying to look at the transcripts to understand what was sort of this just knowledge about placing agencies that they had in general, and then what was sometimes this new and other previous information that they might have that just might impact in the decision making overall. The previous one we looked at as being more sort of factual and objective information about the school. This one we looked at as being more some of the subjective and experiential relationship information that occurred in interacting with the school. This new information, the values, the cultural traditions and norms, looked at sort of the norms of the unit or the practice setting, and then this overall assessing, analysis and synthesis of assessing fit, and a huge piece that they also talked about preceptor and the other process nuances around if it's a preceptorship placement that also comes into the decision-making factor. And so they talked a lot about how they actually decide on the preceptorships, which was quite fascinating in itself. So just to give you sort of a snapshot of some of the new information, which was really quite interesting, was this whole broker role that they took on reading their staff. And they were really quite diligent in trying to get a pulse on the unit for where their staff was at, and whether or not they had the capability, the willingness, their overall well-being to look at, and then also preferences, and trying to be fair and equitable in the distribution of the workload as well. And so they talked a lot at length about how they really had to pay attention to their staff before making decisions about requesting or confirming a request. This is one of the quotes. I'll maybe just let you read it for the sake of my voice and just looking at that. So this was, again, the way that occurred in terms of not always using the same nurses, but then also recognizing, creating that environment for the students and bringing newer people on to take on that role of working with students. They were quite deliberate in their decisions based on the staff needs. So although you do hear of people just sort of clicking the decline button, we really thought that what they were telling us, this was a unit from low acceptance, that there really was a lot of rigor in their decision making to look at what was needed to help support the staff given what else was happening in the current work environment. And again, this is just reflecting of looking at the well-being of the staff. Another piece of that orientate phase was actually assessing the fit. And this was then the component around looking at the good match between the school and the practice area. And so that's where I was highlighting the information that the placing agency can provide on HSPNet is really vital. Because sometimes the broker is doing this in isolation of not necessarily having a lot of information. Or this might be the point where it's really helpful to know who the contact person is so that they can pick up the phone and talk to the person at the other end of the phone that's from the placing agency so that they can better understand what their needs are if they have questions. Particularly if this is a new area, a new practice setting that you're using or making a request to. This was some quotes, again, of looking at trying to find the right match and the fit that would work with the unit as well as the staff. And this last quote then reflects just some of the negative experience that's kind of overweighs sometimes the decision-making process because of what's happened. And recognizing that we looked primarily in our sample over a range of sectors rather than a range of schools. So these could be from any schools in the BC Lower Mainland. And this, again, This was from a maternity unit, I believe, or perinatal unit. And this is a unit that is practically used probably from 7 in the morning till 11 at night, with undergrad, specialty, lactation consultant students, sometimes physician students, and a number of others, midwife students. And so this just really talks to the detailed nature of then sometimes being selective of who are the students given what's happening and what their interest is in perinatal, and really looking at, is this a particular request that's required for credentialing, or is this a particular request because there might not be any other place or sort of a nice to have placement that might be coming. And again, sometimes it might be those placements that weren't, the school wasn't sure what, hadn't read the capacity or put the request in, and so it might not be an appropriate request. And so the broker really being selective in the decisions that they're making. So from these you can see that the previous experiences, as well as the increasing internal pressures, sometimes influence the decisions that are being made, and some of the inequity that might occur in these work decisions. So I'm just giving you a bit of a flavor. There's much, much more to talk about. Really fascinating to them to also talk about the values in terms of their value and commitment to the nursing profession to support students, but their values to also support the staff that they work with. But also they talked about their values in providing experiences that were appropriate for the patients, and how much they also weigh in the patient's needs to that. And so really strong values in terms of balancing and juggling all that when they're making a decision. And how is this also appropriate for the patients that are there, and the level of student that might be working with those patients. And so I recognize I'm giving you a really small snapshot of this overall decision-making process. And hopefully you can get a sense of the complexity that's involved in that purple box that I first showed you, and those individuals really looking at how we can support them to make decisions for these requests that sort of appear in their inbox, and some people being quite novice in doing that. Also being not, novice as a clinical nurse educator in general, but then also novice in supporting students. And so for me, some of the big implications were how we were using HSPNet and it having the right tools, and the tools that were there to be utilized effectively. For example, with the capacity tool, schools being able to attach documents that would help the destinations understand what the request was about. But a big piece for me, and still is that preparation for the broker role, and how we as a health authority can help support people as part of the orientation, to support them for the complexity of the decisions that they're being made, and the guidelines that are out there. So we also have the practice education guidelines that are utilized quite heavily within Fraser Health, and looking at as another resource that the broker or the destination coordinator needs to know about. And certainly reinforced our need in Fraser Health. We have the Educator Pathway Level 1, which is for mentors and preceptors. So there's a foundational mentorship, preceptorship workshop, as well as an advanced preceptor mentorship workshop. And so that's really pivotal in making sure that people know that they can utilize that as a resource to help support people in the roles, in supporting students for the unit culture, as well as those that might do one-on-one preceptorships as well. So I'm going to leave it at that, knowing that we don't have a lot of time for questions. I actually see Andrea is also on the, has called in, so I'm really glad that Andrea is also here as well, listening to the presentation.
So we have a little bit of time for questions. For those of you online, if you have any questions, if you type them in the chat box, we'll try to get to them. And for in the room, if there's any questions.
And I apologize for my voice.
You've done very well.
Yeah.
Just very briefly, Angela, this is fantastic, having lived through this process of Term 5 coordination for 3 years. To see this data is absolutely wonderful. And I do want to say, on an individual note, that Forrest has been immensely helpful for us this term, and always has been. So we've been getting great support from Fraser Health and the complexity of our upcoming preceptorships. What I had sort of two ideas. One is, and you don't need to respond extensively, when you went to the factors that were influencing, something that I noticed wasn't named there, but it may be in your analysis, that reduces the fit for a unit, is not just the numbers and resources, but have they just experienced a major change? Because that process of being in the midst of, or at the receiving end of change, Lynn's got tons of experience in this, that notion of a unit that's changing seems to be really a powerful determinant. That was one point. Then I have a second one that I'll come
So
back to.
Patty's question was around, I didn't talk much about some of the change that might be happening at the unit level, and also say within the organizational level.
Yeah.
And yes, it certainly was in there. It was probably in a couple of places. Some of it is the unfolding circumstances in the practice setting. Some of it, we looked at that as being more micro, as like what was happening right at the practice setting. So maybe they recently changed as well from being a medical unit to an ACE unit.
Yes.
That would be some of the unfolding circumstances.
Yeah.
The other piece was around the organizational context as well.
Oh, good. Okay.
And I didn't talk about that at all, but that is at the macro level, the whole organizational piece that's happening in terms of changing priorities, changing initiatives, budget cuts within the ministry. Right now, going through a new CEO and changes to the organizational structure. All those decisions would fit under some of the organizational context that is part of this feedback loop that would then impact the observation, the orientate, and then some of the decision. And some of it fell within this whole fascinating piece about protecting your staff. Because of these things happening, the broker was really protective of their staff and looking at how to minimize and take into consideration this organizational context and change, while also taking care of the staff. And I didn't go over those quotes, but those were quite fascinating as well. And they talked a lot about, particularly the preceptorship, how they had this sort of respite, sometimes respite periods for the preceptors, and that was also very fascinating as well.
So then the second thing I wanted to say is just a brief comment. This is so important at a macro structural level that one of the things that I've been trying to promote is that this also should be something that a group like ARMBC is involved in terms of provincial level planning, along with NECDC. And I'd really like to see some collaboration with our sort of macro level provincial nursing organizations around this, because it's so linked to advocating for nursing and health care. And I think that we run into so many challenges, and they're probably going to get harder before they get easier. So, and kudos to you guys for doing this. Thank you.
Yeah, thank you for your comment. I'm going to get you to read the question.
We do have a question
online. But this, as well as the places study, are very important because we actually have data as opposed to anecdotal knowledge about what's actually happening.
So I'm just going to read this comment out that was shared from online. Thank you to Angela for the presentation. Also, this is very rich information, and the UDA loop shows its complexity. I was put in the position of accepting students this summer while the CNE was on leave. I had no training or support, and I relied on the PCC to help me make these decisions. Unfortunately, there ended up being too many students on the floor. Thank you so much for sharing that comment.
Oh, thank you for that comment. You were probably reliving the whole OODA loop and could feel all these arrows going back and forth at you. And it was, people like yourself as well that really talked to us out loud about, what this was like, being in that purple box and trying to make that decision. Yeah.
Thanks, Angela. I just wanted to acknowledge the ways in which you unpacked the destination coordinator role in the purple box. Because back in the early 90s and the 2000s, when we were having this discussion about the system coming into place, many of us were very worried, and as a placement coordinator then, we were very worried about that person piece that was going to be lost behind the system. And so now that, you know, there's a role as a destination coordinator, you so nicely talked about the roles and responsibilities, but also the characteristics and the decisions that they have to make. And so there's a lot of weighting behind the person behind the system as well. And I'm sure there's a lot of transitioning for the destination coordinators themselves in accommodating.
I think two things. Overall, everybody that we interviewed was incredibly professional, and they were striving to be professional in this role. It was every single person that we interviewed. And I also want to shout out to Andrea. I don't know if she's still on, but she was amazing. She did most of the interviews herself, and she got amazing data. They said everything honestly, and it was amazing.
And they had no idea that they were low or high. They just knew that they were invited. So it was great to have a mix.
Well, I want to thank you. We're going to wrap up a little bit over, but it was a great discussion. Thank you for your presentation and everybody for joining us in the room and online. And next rounds is March 16th.
So it'd be great to have any, other discussions and looking at some of the nuances. And you can see a lot of the implications just at both ends of how we can better support everybody within this overall nicely laid out process. Has a lot of things going on embedded within it.